Awesome to be here today. I'm here with Zig Ziglar, a friend of mine for many years, and I think the reasons I have you on my podcast today will become evident because there's a lot of different reasons I wanted to have you here. But why don't you just kind of tell everybody in the audience and even remind me all the things that you're involved in and what you do professionally and how you work with people.
Sure, super. No, thank you very much. Hey, it's a pleasure to be here. So I guess my official title is sports kinesiologist.
Right.
I've spent the last 27 years developing exercise programs and corrective exercise programs in particular for athletes, with the big emphasis being on, back in 1999, I first got exposed to motion capture technology for analyzing golf swings. So that really kind of jump-started what I thought was the phase of my career that I'm in now, which is I spend a lot more time doing assessments, identifying exactly what it is that people, that's impacting the way people move.
Right.
And then my mission is to help people improve their sports performance, first of all and foremost,
right,
while reducing their risk of injuries or help them recover from injuries a lot faster.
Right.
And I use motion capture to do that.
So explain a little bit more. I think some people will know what motion capture are. Not everybody knows what motion capture are. Like what is that? That's like them video people. I mean, what is motion capture?
Sure. Most people are probably more familiar with motion capture from a standpoint of video games. So the same technology they use to make video games has been used for years to also in the medical field.
Right.
So my first exposure in 1999 was from a Phoenix-based company, which actually used electromagnetic sensors that they would place on the individual athlete, and in that scenario they would put anywhere from 4 to 12 sensors on. They'd go through and digitize, and it would create this 3D image. But behind the scenes, there's a lot of data.
Right.
And the data that I focus on is the efficiency of movement. How did your feet move with respect to your legs? How did your leg move with respect to your pelvis? And how did all of that tie into the rest of your body, whether it is swinging a golf club, running, which is a real big focus of mine right now, or just any human movement in general.
Right. So it's a really big deal. Because if you're an athlete and your motion is off, my understanding is like what you're saying, right? That's going to translate into, you're not just going to, it's not that you're not going to just perform at the top peak level that you could be performing, but risk of injury rehab. How does that all tie into it?
Well, that's you hit the nail on the head. Most people, they're focused on, hey, I just want to run faster, swing the golf club better, or score better, beat my friends on the weekend. But when you've got something that is breaking down, and if we analyzed whatever that motion is, whether it's a sport motion or something as simple as gait, walking or running, being able to identify that some muscle or joint is being overloaded. One of the things that I say all the time, if I back up for a second before I finish that statement, is every single muscle, joint, and segment in the body has a job to do, and that is absorb, store, and release its appropriate share of the workload while we're performing any activity. If something is absorbing more than it's capable of handling, that's where the risk of injury increases, but also it impacts their performance because they're now going to have to compensate for that area that took too much stress.
Right.
And we don't think about it, but a lot of things that we do every day are repetitive motions, even when it comes to sports. And the repetitive nature of those movements can actually create imbalances that lead to injury down the road. So for me, it's all about identifying the imbalances that impact the way you move so we can address those and create an opportunity for anything being possible for you.
So connect the dots for me with how this impacts your regular person in your day. This is a show, a lot of what this show is about is longevity. So one of the things I wanted to have you on, because I want you to connect the dots of what you're talking about right now in terms of athletes, connects to our own individual human longevity.
Well, that's perfect, because one of the things that I tell people all the time also is it doesn't matter what sport you play. A lot of programs out there, a lot of individuals are involved in some kind of physical activity. So I consider everybody an athlete if they're exercising. But the average person, if I use the analogy of a car, okay, we want most of the time a car to last for a long time, or if we're financing it, at least until we finish making the payments.
Right.
Okay.
Don't have that luxury with your body, though, do you?
No, you don't, because when your car starts to break down, very quickly we go, hey, I'm hearing a noise, or that light's on, so it's some kind of warning indicator. We immediately take the car to the mechanic.
Right.
When it comes to our bodies, though, not so much. You know what a lot of people are doing, Doc? They're Googling the answer, and there's a lot of misinformation that's out there, and most importantly, that information doesn't apply to them. Or they're asking a friend who had a similar experience, right, and then that friend comes back and says, well, I did this and it worked for me, you should try it too. Social media is full of all these different groups, survivors of ACL injuries, plantar fasciitis, and so forth. And so people go into those groups and they go, well, I'm just going to do what that person said. Right. And then it didn't work for them.
Right.
So what motion capture or motion analysis, biomechanics assessment will do for someone, regardless of what activity they're involved in, right, is it will help identify what the root cause is that impacts the way they move. Rather than, I got a symptom here, I want to treat that symptom.
Right.
Let's address the root cause.
Yeah, I love the analogy. I was thinking too when you said the car analogy. I want to expand on that a little bit, which is, one is if you think about the engine light going on, I mean, there could be a thousand things. I don't know. I'm not that kind of engineer. I mean, I look for an on-off switch when I open up my car hood if something's going off with it. But I know that there could be 1,000 different things that could be wrong with that. So the symptom, which is that engine light going off, the symptom might be your knee pain, but I know as a doctor, as there could be 1,000 different things that is causing that knee pain. I mean, maybe you bumped your knee yesterday against the wall and there's just some swelling that needs to go down because you have a little bruise in your knee. As to there's some serious biomechanical issue going on that could be caused by some type of repetitive injury. So the analysis is so important, and when you're thinking about your body. With the longevity component, these little functional things that are going wrong, what does that lead to down the road that there's an important for your average everyday mom, Susan, Jane, John, Joe, to be looking at these things, whether they're in their 20s, 30s, or 40s, mm-hmm, in terms of how that might affect them when they're 80, 90, 100, and so on.
Well, I tell you, the longer you ignore the problem, the worse it gets. And the other thing that I found is the human body is a great compensator. So if we're talking about someone who is, let's take a 10-year-old, because I use this analogy a lot. As a 10-year-old, you have an accident where you fall off your bicycle or down the stairs, or maybe your brother or sister, does something and causes an injury. In kids, typically what has happened, I guess, in the past is a lot of times we say, you're a kid, you put a cast on you, you're healed, you're going to heal faster than everybody else, right, you'll be fine. But what I found is, especially through these assessments, the earlier you had an injury, the more time you had to develop ways to compensate and work, right, around it. And so when you're talking about longevity, if I had an injury early on, or if I had something that was repetitive that caused my body to get out of alignment, that's going to impact my quality of life over time. So by the time I'm 20, it's had an impact on me. By the time I'm 30, I'm now on the downside, right, of my body's done developing and growing, and things start to decrease in terms of chemical displacement in my body, natural chemical production, things that impact, right, my growth. Now, all of a sudden, I'm 40, and that injury I had when I was 10 years old is affecting the way I walk. Maybe now I need knee surgery, or right, maybe I had knee surgery in high school, and now it's affecting me in ways that I never thought about.
Right.
Yeah.
Yeah. Knees are such a good example. I mean, I always think this when I see patients who have knee surgeries, because almost nobody has had just one knee surgery. It's they had a knee surgery. Yeah. They've had knee surgery, and it's just, that's always the story of multiple knee surgeries. And my guess is, and what I see, and I'm guessing you see this too, is that there's biomechanical issues that probably were created by the surgery in the first place that just, yes, the healing occurred after the surgery, and usually these surgeries were helpful and they were necessary. Maybe they weren't necessary, but they served a purpose. And I would say most of them are successful in terms of the patient felt better afterwards. But if they don't correct these biomechanical problems that might have been created from the healing process, it's just, okay, well, 10 years down the road, you're looking at another knee surgery and so on. No,
you're exactly right. And I'd say to people all the time, look, the surgery addressed the symptom. It addressed the emergency need that we had to take care of.
Right.
But if I had ACL reconstruction, anterior cruciate ligament, to repair my knee, and you had it on the exact same day, even if we did the exact same thing to cause our ACL to tear, the reason why mine tore is completely different than yours.
Right.
Because I've got my lifestyle that led to my imbalances, you've got yours that led to yours. And that's the biggest reason why I say there's so much misinformation out there. What worked for you may not necessarily work for me. It could for a little while,
right,
but most of the time, I'm just making myself think that it's working.
When's the appropriate time for somebody, post-surgery, whatever, it's a knee, an ankle, sometimes, let's just say some type of joint injury that somebody's had and had a surgery on. When's a time for them to start looking at this? I mean, is it 6 months after surgery, a year after surgery?
Ooh, that's a great question.
I mean, there's probably no time that's too late,
As soon as possible. In fact, there's even a way to be preventative, and that's one of the things that I've done in my career. When I used to consult with professional sports teams, I was evaluating the biomechanics of their athletes for the purpose of determining their risk for injury so that they had increased career longevity.
Right.
Because if I can determine in a pitcher that something they're doing is overloading their shoulder or their elbow, then I can prevent potentially that injury from occurring down the road.
Yeah.
Same thing happens with a regular person.
Right.
Okay. So my belief is you address it. If you tear your ACL on Monday, there's going to be some period of time where the surgeon wants to let the swelling go down before they can go in and operate. There's a period of time. During that period of time, though, you should be trying to get as strong and as flexible as possible, trying to get your body to be prepared for the surgery. So in that scenario, most people will go, I'm just going to go do this on my own. He just said to start working out.
Right.
But in reality, what you should do is start to consult an expert then to say, okay, what was the potential cause of my injury?
Right.
Because the cause of your injury was not what you did, it's what imbalances were present to begin with.
Yeah, that makes sense. And it makes I never even thought about the whole prepping yourself for surgery to heal in the process and to aid yourself then in the rehab and the recovery that you're going to need.
My gosh, it really speeds up the recovery process.
Right on. All right, talk to me a little bit, because I know you work a lot with people related to their feet. Mm-hmm. And talk to me about the importance of that. I mean, even how did you even get started with that, what you see?
Wow. Probably what got me started is my own feet.
Okay.
I think back to as a freshman in college, I was exposed or introduced to orthotics because I had a stress fracture as a freshman on the track team at Oklahoma State, and ended up with plantar fasciitis. I had a bunch of injuries, so they sent me to a chiropractor who introduced me to orthotics, and I started to wear orthotics from the time I was 19 years old. Well, maybe I was 18 the first time I started wearing orthotics. What I found as I wore them longer was my feet got weaker. Because what most people don't realize is orthotics themselves are a cast.
Right.
And originally they were designed to correct for weaknesses and dysfunctions in the feet to allow the feet to heal. And then they were supposed to go away. The interesting thing is today orthotics have become a crutch.
Right.
They've become something that in the industry, all over, and from people who really don't have the information that they need, hey, you should get a pair of orthotics. They help me. You should get a pair of orthotics because they help my other patients.
Right.
But in fact, what should be happening is we should be addressing the reason why you need them in your feet in the first place, and that is that your feet are weak. you know?
Yeah, I mean, because even with the experts, I mean, out there is kind of like these two camps when it comes to orthotics. Is that still the case? I mean, I know it was like that 10 years ago.
Unfortunately, it's still the case, and I think it's
and kind of explain to me the two camps.
Sure.
Even like Steelman, the orthotic camp of like put them in the best light of like why they would say. I mean, what's the arguments kind of with the two camps?
Well, I tell you this: if you've had an acute or a chronic injury that requires you to brace, whether that's your elbow, your knee, your hip, your back, that requires you to brace to allow the inflammation to decrease, the pain to go away so that you can start to treat it and care for it,
right.
Or allow it to heal, then the same thing applies to your feet. That's what orthotics were intended to be. So when you look at the camps that are out there, the two different camps, and by the way, the one camp is extremely bigger, and that camp that's bigger is everybody needs orthotics.
Right.
Everybody needs something to go inside of their shoes. And
at all times.
And at all times.
Right.
Okay. But then there's a smaller segment of the professional population that says, no, we've got to introduce exercise to their feet. And think about this. A lot of people right now, and you'll hear this from experts in physical therapy, chiropractic care, any kind of physical medicine, trainers, coaches, they're all saying, hey, you need to do something to exercise on your feet. So we've gone to this barefoot or minimalist shoe scenario. And then there are people that have these orthotics. But if you think about this, I've been wearing here's an example. I've been wearing a high-tech shoe to accommodate for my weak dysfunctional feet. By the way, shoes by themselves weaken the feet. They impact the foot's ability to naturally feel and give feedback to the brain.
Even if they're Air Jordans?
Even if they're Air Jordans. Okay. Especially if they're Air Jordans.
Sorry, cut you off there.
But if we're not used to our feet activating, just going barefoot, and I say this all the time, just being barefoot is not enough. Because if you've worn shoes for 10, 20, 30, 40, 50 years, which is all of us, unless we're not that old, then that's a lot of time that your feet have been shut down. Okay, right. So now just to go barefoot or into a shoe or something that increases activation or potential activation of your feet doesn't mean that your feet are going to activate.
Right.
Yeah. So the flat shoes, like everybody nowadays will do workouts in flat shoes. You go to the gym, you see people doing, it's leg day, so I'm wearing my Converse.
I love just look at all the different shoes that people.
And it's like, no. Yeah, no, don't go wearing flat shoes with weak dysfunctional feet. You still need your feet to activate. Or going and doing things like barefoot training. That still doesn't mean the feet are going to work.
Right. And I will say as a healthcare practitioner, I mean, I didn't even hear the other side. I mean, I was a person who used orthotics in my practice and saw good results with orthotics. I mean, people came back saying, Doc, this is really helping. I mean, you know, and so I saw results with that and literally was taught that you actually, like, once you kind of lost your arches, you lost some of these things, like, that wasn't something that you were capable of getting back. And it wasn't until I met you, and, you know, I'm so interested in all this stuff and whatever, and talking to you and got educated by you and literally started using your insoles and had some profound experiences myself, knew actually that the other paradigm and the other conversation was there. So I know from like experience and somebody who's like a seeker of knowledge wasn't even aware that, you know, that orthotics, and it's so interesting the way you say orthotics if you think about them as a cast, which was their original intent, because just think, I mean, who wears a cast and then just expects you're like, get the cast off as soon as possible. I mean, that's the philosophy is, you know, if we do surgery on your knee, we want you out of that knee brace as quickly as possible, and we want you walking on it, moving on it. You got to like re-engage that knee. So why would it be any different for your feet?
Well, and it's really not. I mean, think about this. There are 40 intrinsic muscles in the feet, okay? Plus all the nerves, and most people don't even realize that sciatic nerve runs underneath the foot. So when you start to look at, I've been wearing a cast, my foot's been turned off. you've turned off all those nerves. So we end up with a lot of, I've seen a lot of people with neuropathy that can be improved just by starting to activate the muscles of the feet. And so the insoles that I prescribe are what we call non-orthotics. They're designed to reactivate the muscles of the feet, stimulate nerve function, and as a result of stimulating nerve function and proprioception in the feet, the whole body starts to realign.
Right.
And if your body starts to realign, it makes everything else that we do last that much longer. So when people come to see you, they're getting results that they might not have gotten before. They would have gotten some portions, but they're getting some additional results because their feet are now turned on. The brain can go, hey, foot, brain, rest of body connection. The signal's not interrupted anymore.
Right. It's completely synergistic to what we're doing, which is about also correcting the biomechanics. And the reality is the feet are the foundation to your house, literally and figuratively, you know, and if that foundation is off, there's the biomechanics are just going to always keep on getting up, you know. So I might be correcting something in somebody's pelvis, but that correction is never going to hold, it's never going to stick if the problem originated because their foundation, their feet were off, or even if it didn't originate there, their feet are off, we'll keep on causing it to go back.
Well, use the car analogy again. Think about this. If I got 4 tires on the car, okay? If when they're all even, the car has the ability to run smoothly. But if one of those tires is low on air, okay, significantly, got a flat tire. Think about this. You get a flat tire on the front tire. Immediately the car starts to pull in one direction or another, depending upon where the flat is. Your body's going to do the same thing.
Right.
Yeah.
Right. And the other thing about them, and I want you to kind of discuss, is it sounds like, when you talk about it though, it sounds like a lot of work. The reality is with the insoles, I mean, it's no different than the process of anybody who's ever worn an orthotic. With the non-orthotics, it's, in terms of what you're experiencing as what you have to do, it's the same process, right? I mean, different things are happening, but explain to...
Sure, let's talk about the traditional orthotic.
Right.
Okay, traditional rigid or cushioned orthotic is designed to do 2 things, one of 2 things. Either stabilize your foot with a rigid one, or provide cushion for those feet that have started to deteriorate in terms of soft tissue and the ability to absorb impact. Okay, those are the 2 things. What our non-orthotics are designed to do is, through a progressive system, a leveling system, gradually increase the amount of stimulation in your feet. So just like those traditional orthotics, you take off your shoe, you slip these in, but the difference is, before you slip them in, there's a little slot in the middle. Okay, and in that slot, you'll place one of the different levels of stimulation, and over time, they gradually increase in size and the amount of stimulation that you're getting. So just like you would change your weights in the gym or the exercise, when you're exercising, you're introducing exercise to your feet. Now here's another difference. With a traditional orthotic, it's been custom molded to accommodate the weakness and dysfunction of our feet. Most of the time that's to lift up the arch, to provide support to it.
Right.
Well, if it's providing the support to the arch, what are the muscles of the foot doing? Nothing.
Right.
Okay, so the difference is, instead of supporting or cushioning, we're going to say to the foot, hey, you can support and cushion yourself. You've just forgotten how.
Right.
In fact, you probably never really even knew how, because from the time you were born, we stuck shoes on your feet.
Yeah, it's my scientific mind. It's, I mean, one is like a negative feedback loop, because you're weakening the area that's weak already. You're getting support, but negative feedback loop. You're not strengthening at all, which the difference is this one is a positive feedback loop.
Yes.
You're actually addressing the area, both are addressing the area of concern, but one is providing that support, not re-strengthening, re-stabilizing. The other one's actually causing you to re-engage. And that is going to prevent, because the areas of weakness and where the biomechanics is off is where more decay and degeneration, that misalignment, that tire that's flat, if you don't correct that, you know, if one of your tires is off alignment, that's the one that's going to wear and tear, and eventually you will need surgery. You will need to replace it or do whatever. You can't, I mean, unfortunately, can't replace your foot like you can a tire, but.
Well, and not just the tire, it'll be something else too. Because think about it, I'm driving the car. Now all of a sudden I have to exert more effort just to keep the car in alignment, even if it's not flat all the way. But when it goes flat, if I'm driving it, it's going to say, "Ooh, get over here," and I got to go, "Oh, my back hurts now."
Right.
Why does your back hurt when your tire's flat? Well, because I had to compensate for it. So now I come to you and say, "Hey, my back is hurting," and you as in the traditional industry says, "Oh, well, we can fix that back."
Right.
In your office, you're looking at what's the root cause of that. I can treat that symptom, but what else is going on? Oh, so if I don't fix what's happening over here, the relief that you got from the back pain will go somewhere else.
Right.
Yeah.
You're so passionate about this. You're such a good educator. You educated me. You came in and you educated my staff. What are you doing now to get the word out there? I know we were talking like a little bit before we started filming here of just kind of some maybe platforms that you're looking to build out, how you're going to be educating more people. Because it's just, to me, that's like super exciting. And like you're like, I want to talk a little about like the broadcasting you do too, because I mean, you're a voice that's out there and you're kind of a gift to the world in that way. So how are you working on, you know, if somebody's listening to this and they want to learn more, I know you're going to be building on some things. What are you doing right now to kind of educate the public more?
No, absolutely. Look, I have, like I said, I spent the last 27 years where I consulted with teams. And then the last 4 or 5 years, I've said, let me hunker down and have a home base where people can come to see me, which is where we met. We met at my store, which was 100% focused on the insoles. Then I pivoted to a facility where I focused more on assessing people with a foot pressure assessment. I also, though, do treat people remotely where I have asked them to send me photographs or videos of their feet from 2 different angles so I can evaluate the posture of their feet and give them a recommendation based upon that. But my real passion is I've now decided to close that facility where I was working with these athletes to focus 100% on my new radio show, which is on the air with me, Zig Ziglar, the sports kinesiologist, and I've signed a new deal with the ESPN radio affiliate out of Las Vegas. So my show will air there, thank you, on Saturday mornings at 10 a.m. starting in September. Pandemic free, I hope. Hopefully we're back to operating in the world where we can get back to life. But also through that, I have a couple different programs that we offer. Our Fitness from the Ground Up program, which is from our website at zigziglar or zigziglar.net, or fitnessfromthegroundup.com, where people can sign up for the opportunity to get an evaluation, to enroll in our Fitness from the Ground Up program, which includes a pair of insoles as well as some corrective exercises to go along with that. And in addition to being able to, I'm now freed up to travel when we can around the country to spend more time with doctors' offices, medical offices like yourself, sports performance facilities, physical therapists, to spread the opportunity for them to offer our insoles or one of our gait analysis, our running assessments to their patients.
Super exciting.
Yeah, full curriculum.
Cool. Yeah. What does the radio show focus on, and what do you?
Well, my passion and mission, I guess I should say, my chief complaint is always, whenever I saw an athlete...
Chief complaint you're talking about.
Yeah.
Let me get a paper.
Yeah. Whenever an athlete came to see me, or someone would come to see me, even if it was for insoles, whether it's an 80-year-old lady or someone bringing their 8-year-old son or daughter, my chief complaint was always that I would see them, I'd make some recommendation, and because of all the misinformation that was out there, they would go back to their primary care person, whether it was a coach, doctor, physical therapist, whoever, and they wouldn't have the same level of information just because they weren't exposed to it. And my philosophy is, look, I didn't know what I didn't know until I started testing people.
Right.
Okay. So I can only imagine that there are a lot of people out there who don't know what they don't know until they get exposed to it. So my complaint was I would send them back and they would go, Well, that's not going to work.
Right.
And then it would work, and they would call up and go, hey, what are you doing with those people?
Right.
Because that seems to work. Or there were other cases, and this was the real thing that led to my complaint, was they would dismiss it and make other recommendations, so it would create this tug of war with, who do I listen to? This Zig guy who gave me these data-driven assessments, or this other person over here who says, without assessing me in the same way, that, hogwash. That doesn't, there's no perfect posture. There's no perfect walking form. There's not a perfect way to do this. Well, in reality, there is. We just don't do it.
Right on.
Yeah.
That's great. That's great. So like with doing like more of the radio stuff and things like that, is there like any other like new directions you're going to be going with that?
Well, the biggest thing that is coming off of that is, so on my show, we've got a couple different things, a couple different challenges that are designed to inspire and stimulate some kind of response from our listeners. I've got my YouTube channel as well, which will be a place where people can visually see what we talk about on the show.
And I'll leave links to all this stuff too, so
Perfect.
When we're putting this up.
Perfect. But on the show, we've got our running fitness challenge, which is designed to inspire runners to pursue perfect form.
Right.
Nobody's going to get there.
Right.
Well, I hope somebody gets there, because if somebody does get there, there's $1 million prize tied to anybody who can, on our final show, achieve a score of 100%. Score
Really?
90%.
That's like for real. There's $1 million.
For real, $1 million. Okay. Insured, so it's not my money. But it's possible. The goal, like I said, is to inspire people to look at how
certainly everybody can be better then. Like, right?
Everybody can be better.
Right.
I mean, think about it. Here's something and this is something that I'll share through some of the seminars that I'll be putting on online, which will be available for people to enroll in on my website. Wow. Okay. In the early days of my motion capture research, I would do things like what we call a functional movement screen or a squat analysis. We put a bunch of sensors all over the body. I would grade them. The system would grade the comparison of all that data to, if you were a perfectly fine-tuned machine, where would your foot be, your lower leg, your femur, your pelvis, your spinal alignment, would there be any rotation, your head posture, your arm, everything is all connected. You'd get a score. The average person scores 50% out of 100%. I have tested professional athletes who score less than 20% efficiently on something as simple as a motion of squatting down and standing up, squatting down and standing up.
Right.
On my gait analysis, my running and walking analysis, the average person scores less than 50%. So if you're walking around
That's like incredible.
Yeah.
I mean, that's like a epidemic, of like unbelievable.
But we don't know.
Yeah.
We don't know what we don't know.
Right.
And this isn't just from 100 people. This is from over 75,000 people that I've assessed.
Yeah, I was going to ask, what are you doing with all this data? You kind of answered it, but like, what else is coming out of this? I mean, that's just shocking to me.
Yeah, well,
I know because I assess people and I watch people. I mean, I can't help myself. I watch people move and whatever, and I guess, everybody's kind of screwed up. I know that, like, looking at people. But I'm even shocked to hear how bad that is. And I just know, again, that's that every car on the road is misaligned.
Yep.
Like, all those cars are going to have a shorter life because of that. And that certainly translates into human health and well-being.
Oh, can you imagine shorter life if your job every day was standing up and sitting down, up and sitting down, and you do it at a 50% efficiency rate? Something's going to break down.
Yeah, and living with pain is it's just a horrible thing. It doesn't just affect you physically. I mean, that just lowers your quality of life. And if you expand these, it might seem little when you think of that, how it affects one person. But when you look at that kind of statistically, those are the numbers. And to just know without a question what that leads to, which is somewhere down the road, aches and pains and discomfort and surgery, and it's an expense on us to our healthcare system. I mean, on every level, it is something that really should be looked at.
Oh, absolutely. Look, we're conditioned to say, I've got knee pain because my knees are weak. I've got ankle pain because my ankles are weak. You don't have weak ankles or weak knees or a weak spine. You have weak muscles and weak signals that aren't making it to that. And if that's happening and you're scoring 50% or
Right.
less, and let's say you're a marathon runner or you work a job where you stand on your feet all day long,
Right.
Dr. Steve,
Right.
okay, your body's going to compensate to achieve the job that you ask it to do. Your body will always find a way.
Right.
Until it can't.
Right.
And then when it can't, we go, now I need a surgery. So a lot of my mission and my focus is to change the mindset first and foremost. You got to first become aware that just the way you walk is an issue. And if my goal is to live for 50 years, 75 years, 100 years, 125, why are people dying early? We die early because things have broken down. Things have stopped functioning the way they're supposed to function.
Right.
If they continue to function at a high level, who knows how long we could live?
Yeah, 100%. And as technology is improving, regenerative medicine, stem cells, like I said, people don't even, I don't think people realize, maybe some of the listeners here realize what's going on in the world of regenerative medicine, which is fixing a lot of these problems that we associate with what aging is. But one of the big problems that we just think it happens to you because, well, that person's 70, of course they have arthritis, of course they have all these things. Most of those things, those structural things that you see when somebody's 70, 80, 90, are actually preventable.
Yeah.
They're completely preventable, and like brushing your teeth when you start early, you just have to start early because you just don't wake up and you're like that one day. You just don't wake up one day and have the hunch on your back and the phase 3 decay and degeneration in your low back. Just like you just don't wake up one day with a cavity. You might feel the cavity one day from biting the sandwich, but guess what? That cavity started 15 years ago. And here's I want to say, and for me, this is why I want people just to feel passionate about this, because this is your body. And if you're going to live to be 80, 100, or whatever age you want to live to, you want to live that in the highest quality. And you are going to live your life through this body. And people need to know that they can just empower themselves in actually very simple ways. The things you do with people at a fundamental level is very simple. And it's the more simple it is the younger you get started, in my opinion. How young, because I had my kids assessed, a couple of years ago, so they were 7 and 9 at the time, they're 9 and 11 now. When is a good time as children to start looking at biomechanics and things like that? I mean, I have my own opinion about it, but I want to hear your opinion. And how young do you start working with people?
Sure. No, I believe that you start working as early as possible. Okay. So take this analogy, for example. A lot of parents are so eager to new parents are eager for their kids to take those first steps, not realizing that how they take those first steps sets them up for the rest of their life. Do you know how kids learn to walk? I'll share. They learn to walk by mimicking what they see from the people who are around them. Who are the people they see around them? Their parents. Your kids are standing at the crib before they walk, or they're laying in the crib if they can, or they're kneeling or whatever, and they're watching you going, oh, look at what daddy's doing, look at what mommy's doing. That's how they're walking. And so every time they get up to try to walk, they're mimicking you. If you're helping them, which a lot of parents are doing, oh, come on, I'll help you. They are forcing their children from the very first steps to compensate for their inability to walk.
Right.
So the ideal scenario,
it's okay for the kids to fall a few times?
Shoot, yeah. Let them fall down. Right. I mean, hopefully they don't hit their head. But
no, it's part.
But the whole objective is they're going to find their way no matter what, because they're mimicking you. So since they're mimicking you, whatever your issues are, they're going to have too.
Yeah.
So if I think about my own daughter, my daughter has been around running and exercise her entire life. So I think back, I've got pictures of her and videos of her at track meets or in my facility doing the drills that the athletes were doing. And I would say, hold on, if you're going to do it, you're going to do it right. Instead of just saying, oh, it's so cute, look at how you can do it. Nope, get off of it. But we live in a society today where we think it's cute for our kids to behave a certain way that we find funny, or to do things that we find cool.
Right.
When in fact, we're setting them up for failure down the road. Whether that's with their mindset, where we let them be, how can I say this, smartasses,
Right.
or if it's their body, where we let them start to compensate early
Right.
on.
Yeah, and I would say even what you do with people, because I know you are strong on the mindset side, it's I know because I've worked with you and you've worked with me. Part of what you incorporate when you're working with people, and I'm imagining you're going to be doing this in your online programs, is some set stuff. First of all, just talk to me about like where that passion comes from for you, kind of how you got involved in, because you're a strong mindset guy. It's one of the things that's like powerful about you in terms of how you work with people professionally.
Well, what's interesting is, first of all, my name is Zig Ziglar, and most
Yes.
people immediately associate me with the late Zig Ziglar, who passed away.
I'm actually hoping I'm going to get 1 million hits just because I might be doing an interview with Zig Ziglar.
So a lot of people.
And I'm hoping I get it because you'll get the exposure.
Well, I tell you, I appreciate
People
that.
should know. Yes,
Yeah.
but finish the story.
So I'm the other Zig Ziglar,
Yes.
and it's spelled differently. But growing up, it was. When I say growing up, I mean from my 20s to my 30s, because that's when he was popular, when I was in my 20s and 30s. Up until that point, nobody outside of the car or sales industry really knew who Zig Ziglar was, the motivational speaker. So that's a big part of it. But another place that it came from was I was inspired by my college coach.
Yeah.
And I was an athlete and was catered to because I was pretty good.
Right.
And I had one coach after I left Oklahoma State, transferred to a small school in Colorado. And this coach, his mindset was, you got to believe and you got to let go of ego, because your ego won't get you there. Your beliefs will get you there, but beliefs and egos are not the same thing. Yes, there has to be a little bit of room for ego, but that's where it started for me. And then he also focused on,
how was your ego? Like, was your ego an issue?
Oh, it was an issue.
Yeah.
Oh, yeah. Yeah.
I think that happens with a lot of young athletes just because it's what you said. They get so catered to.
Yeah, and I have been catered to from Oklahoma State, from high school to Oklahoma State to this small school in Colorado. I thought, hey, I'm really good.
Right.
So you're going to treat me like I'm good. I want special treatment. And a lot of athletes do that. A lot of people do that, though, now.
Well, it's kind of an epidemic, I think, with younger generations anyway, of that's the whole helicopter parenting and never wanting our children to fall and you talked about earlier, literally like letting our kids fall when they start to learn how to walk. Of course, they're going to fall when they start to learn how to walk, right?
And we did.
Yeah.
And here's, and I'd like to stay on this for a second because this is important for me. One of the things because I deal with the kids, and parents will come in all the time and they will say, well, I know my kid. No, you actually don't.
Right.
I don't know my kid.
Yeah.
Okay. You know what your kid shows you, and your kid shows you what they know you're okay with. So that's what you know.
Yeah.
But when their kids would come in to see me, if their kids were quiet or let's call it open, communicated openly. Either they didn't communicate or they communicated a lot. That told me a lot about how they were being raised.
Right.
Okay. Did the parents silence them, or did the parents not control them enough to where they had the respect that for themselves that they would show to other people? And that was on both sides, because the quiet kid had a lack of respect somewhere, and so did the louder kid.
Right.
Okay. So we first and foremost got to take a look at, where did that come from?
Right.
It came from us. So all these parents that are walking around saying, all those millennials, and I can't believe they're this, or Generation Z, they're all so entitled and this and that. You know who raised them? We did.
Yeah.
So you want to be upset with somebody? Be upset with yourself for how you raised your kid. But guess what? It's not too late.
Yeah.
Because it's not just your kid, it's you. And so it's an opportunity for you to impact yourself. So a lot of when people are dealing with me and they have a relationship with me, I'm addressing their relationship with themselves first and foremost. And that, even for me, a lot of my formal training for that came from, my enrollment in the Landmark Forum program, which is a self-awareness and discovery program where I got to let go of some of my own crap, and I think that course and that program by itself for me made a difference in not just the way I see myself, but the way I see others.
Yeah.
And I've always read positive books from Wayne Dyer to the Chicken Soup for the Soul books and so forth. I've always been someone searching for information on, what's going on in here, not just what's going on with this.
Yeah.
Because everybody's got an answer for how your body moves or what you're supposed to put into your body.
Yeah.
Not a lot of people really have the answers to what's going on up here because it's in here, not out there.
And when you gave that example of the two types of kids, I mean, and the reality is it does all come from us, and we have all fallen at one point in our life in one or two of those camps too, and that's and I think about this with my kids, and I'm glad we're having this conversation because I know it's something that we're both passionate about, both being parents and working with children. It's so important just to have the tools to be able to self-reflect. And what I see the way that you work with people is, you incorporate that in because at the end of the day, that is going to move them forward and give them the skills to be able to, look at these things and be able to self-reflect.
Yeah, look, every person moves in a way that's unique to their own strengths, weaknesses, their physical limitations, but most importantly, their thoughts play a role.
Yeah.
And if I believe something is a strength, I go for it.
Yeah.
If I believe it's a weakness, and this is society, we avoid it. We stay away from it.
Yeah.
Confirmation bias is one of those things that we think is just about the things that we say, but no, it's about the things that we do as well. When I get confirmation that a picture that I post gets a bunch of likes, I post more pictures.
Right.
When I get confirmation that a topic that I talk about gets a lot of likes, I post a lot more comments or topics like that. It's confirmation of, hey, I think you're on the right page. And until we let go of the need for confirmation of our own bias and let it just be what we believe, we're stuck.
Yeah. I love it. And then just understanding, and we all have it. Yeah. Most people can't even admit that, they think confirmation and bias exists for everybody else. It doesn't exist. It has to exist for you too, know? And so just being able to admit that and be aware of it, that actually helps you in this world, to know that we all suffer from these things. Because we all suffer from the same things. And it's really important. And the work that you do, and I see that you're doing with people, is just really important to be addressing those things. I don't think it's necessary in terms of the work that you do, but I think it's important that you serve that role as well too. And it's one of the things, I'm glad you're on the radio and you're a big voice and you're going to become a bigger voice. And I just really want to commend you on that. And I think it's an important part of what I talk about here because it does relate to anybody's longevity in that sense of you got to have the thinking right. And it's challenging times. It's challenging times with social media. We talk about kids. It's challenging times for them. I mean, the world's changing at a very fast pace with all that stuff. And it's going to continue to, we have to accept it's going to continue to change at a fast pace. Might seem scary. Maybe it is a little scary, but you know what? Let's empower ourselves to move through all this. That's to me, that's the best solution we can all do individually.
Look, I tell you, Doc, you and I are at that age where we have an opportunity and have had an opportunity to gain a lot of knowledge. And now it's time for us to use our wisdom with that knowledge. And I share this with people sometimes on my show. There's a difference between knowledge and wisdom. Knowledge is I gathered a lot of information out there. I read a lot of books. I listened to all of these different articles. I accumulated all this stuff. Wisdom is, what do I do with it?
Yeah.
What do I do with it? And once we know what to do with it, and then we are able to communicate how to use all of that knowledge, then we have a real opportunity to impact the world. And I look at the next phase of my life as it's now an opportunity. I've done it on the community level, done it on the local level, done it on the national level. Now it's time to impact the world.
Yeah.
Yeah.
Well, I think that's such a beautiful place to stop. Definitely want you back. I have a feeling next time we're talking, we're doing this, there'll be some interesting stories. We'll probably both have some interesting stories. So well, thank you so much. I really appreciate you being here, Zig.
Super.
Talk to you soon.
Appreciate you having me.
Yeah,
Thanks,
absolutely.
sir.